Everything you as a parent need to know about sinus infections in kids. Have you ever looked at your kid's green snot and thought, I guess we need an antibiotic? If so, you're not alone. In fact, it's probably one of the most common misconceptions I hear in pediatrics. So today we're going to answer 5 questions. Does green snot really mean a sinus infection? If not, what is it? How do pediatricians actually diagnose sinus infections? How are sinus infections treated? Is there any way you can prevent them? And finally, when should you as a parent really worry? So, what is a sinus infection? Most people think a sinus infection is just a really bad cold. It's actually a little more specific than that. Your child has these air-filled spaces behind their cheeks, their forehead, their nose, and their eyes, and these are called sinuses. These spaces usually make the mucus that drains into your nose and the back of your throat, and they're mostly supposed to be full of air. When your child catches a cold, the lining of the nose and these sinuses swell up, and then that can cause these drainage pathways to become blocked up. Mucus build up, the sinuses become inflamed, and that's what makes you miserable. So here's the most important part. Almost every sinus infection is going to start off as a viral cold or allergies. Most of these viral infections are going to get better on their own. Only a small percentage go into what become bacterial sinus infections that might benefit from antibiotics. That's why we as pediatricians just don't jump to antibiotics every time your child has a runny nose. They're going to get better on their own. Does green snot mean bacteria? No. This is probably one of my favorite myths to bust. Green mucus does not automatically mean your child has a bacterial infection. In fact, it almost never does. So why does the mucus turn green? When your immune system fights an infection, it sends white blood cells into the mucus. These white blood cells contain an enzyme called myeloperoxidase. That's how I make my money, is saying big words, which naturally has a slight green color. As these cells do their job and eventually die, they mix with the mucus and change the color. So that's why a perfectly ordinary viral cold can produce green mucus. Your child's mucus can be clear, white, yellow, green, all during the same illness. Color alone does not tell us whether antibiotics are needed. In fact, I've seen some kids with some bright green mucus who absolutely had no need for antibiotics. Then I've seen kids with bacterial sinus infections whose mucus wasn't abnormally colored at all. So as pediatricians, we don't diagnose sinus infections by the color of their snot. We almost always diagnose them by the story. So, how does a pediatrician diagnose a sinus infection? This surprises many patients. We almost never diagnose a sinus infection by even looking at the kid. We listen to how the illness has progressed. There are 3 classic situations that make us think bacteria may have taken over. Number 1, symptoms last longer than 10 days. Most viral colds are going to improve in about a week. If your child's still coughing, still congested, has any significant like pain, swelling, things like that in and around their sinuses, with little improvement, bacteria become more likely. The second thing, you get worse again. So you started off and usually you start getting better, but all of a sudden something happens, they start to getting worse again. So they started feeling better, maybe they're back to playing, then suddenly a fever shows up again. Congestion gets worse, the cough gets worse, especially when they're laying down at night. Drainage may increase, but it's usually in the back of the throat. This is what we call double sickening, and it raises our suspicion for bacterial sinus infections. The third one, severe symptoms from the beginning. If your child has this high fever with thick nasal drainage for several days right from the start, that pattern could also suggest bacterial sinus infections, but that one's pretty rare. Notice something? None of these mention the color of the snot. So how do we treat sinus infections? Well, treatment depends on what's causing the infection. If it's viral, antibiotics aren't going to help. They're going to go away on their own. Instead, we focus on helping your child feel better while their immune system does the heavy lifting for us. That means give them plenty of fluids. Saline nasal sprays, irrigation, gentle suction for babies, humidified air can help, resting, some fever, some pain medicine when appropriate. And then if the illness meets the criteria for bacterial sinus infection, then we may use some antibiotics. Even then, the antibiotics aren't magic. Most children don't wake up feeling completely better the next morning. Sinuses don't have great blood supply, and that's the way we're going to get that antibiotic to the area. It's usually going to take a couple days before you notice any difference, and then maybe the whole course of the antibiotic before it's actually controlled. The inflammation may take even longer to settle down. There's one reason why congestion and cough can linger after treatment starts. Can sinus infections be completely prevented? No. Children are going to get colds. That's part of childhood. But you can reduce your chances that a cold can become a sinus infection. Some of the best ways are going to include just good common sense, good hand washing, keeping your immunizations up to date. Haemophilus influenza and strep pneumonia are big causes of bacterial sinus infections. Treating seasonal allergies if your child has it. Avoiding cigarette smoke and secondhand smoke. Keeping your child well hydrated. Make sure they're getting enough sleep, that they're adequately have good nutrition. Healthy children with healthy immune systems usually recover from viral infections without developing bacterial sinus infections. When should parents worry? Thankfully, serious complications is pretty uncommon. But there are times when I want parents to call us immediately or even seek emergency care. These would include if you ever have swelling around one eye, you'd worry about paraorbital cellulitis. Pain when you move the eyes, any vision changes, a severe headache that isn't acting like a normal illness, persistent vomiting, confusion, extreme sleepiness, or difficulty waking your child. These symptoms could suggest that the infection is spread beyond the sinuses, and this deserves definitely more immediate medical attention. Fortunately, that's very rare, but it is something that every pediatrician we're watching for. Final thoughts. If there's one thought I want you to remember in today's video, it's that green snot does not equal antibiotics. Pediatricians are not diagnosing sinus infections by looking at the color of their snot. We diagnose them by the pattern of the illness. Most colds are going to get better on their own and don't need antibiotics. Some rarely will turn into a bacterial sinus infections. Knowing the difference helps us avoid unnecessary antibiotics while making sure your child gets the treatment that they truly need. If this is the sort of thing you like, please subscribe, share, give comments. Let us know what other videos you want to do. Well, we try and do this on a regular basis to break down common childhood illnesses.